is Kelly Stanton, and today I'll be talking about Eli's test for rectus femoris spasticity, which is the constant contractions of the muscle and constant muscle fiber tightness of the rectus femoris, which is one of the four quadricep muscles that is mainly involved in hip flexion and knee extension. When there's spasticity in this muscle, the knee specifically is unable to flex properly during walking and gait phases. So a person with this spasticity will have what is called stiff knee gait, which is when they're unable to clear the ground correctly with their foot, which causes them to either bring their leg out when they walk or raise their hip every time they walk, which slows down their gait and obviously causes other issues up the chain. This gait deviation is caused by damage to voluntary muscle control centers within the brain, which is why patients with this deviation are typically patients with cerebral palsy or that have recently suffered a stroke. So to perform this test, you will have your patient lying prone on the table, and you will grab their lower leg at both each end and passively flex the leg as far as the patient will let you. A positive sign for this test would be a lifting of the hip of the affected side, inability for the foot to touch the buttocks, and sometimes even pain or tingling down the leg. You have to make sure that you perform this test bilaterally to make sure that you understand the patient's full passive range of motion on their unaffected leg, so you're able to compare it to the affected leg as well. And the sensitivity for this test is between 56 to 59%, and the specificity is between 64 and 85%. Because these ranges are either low numbers or because they're very high, it is also important to use this test with other tests as well. Thank you very much.